So I had an epiphany yesterday. Because I had to do some digging to find out. I had to call back to Massachusetts, go back to the hospital. I was repeatedly told my mom by various doctors there my mom wasn't going to make it. And I also had to call her former primary care physician, that office, trying to get to the bottom of why she was put on ALICIA, a blood thinner, in the first place. And I actually got confused and forgot that she had been on it for a few months before, her latest thing in Massachusetts. I had forgotten. I was thinking it was a recent medication, just this last hospitalization in Massachusetts before we moved here. But I found out she was put on ALICIA November of 24. And so she was on several months before the shit hit the fan in Massachusetts. Shall I say yet again? ALICIA is a blood thinner. That probably explains why there was so much blood, 7-8 weeks ago. That very traumatic for me thing happened. I don't know that my mom even knew she was bleeding. I don't think she did. Joe doesn't think she even knew. Anyhow, my epiphany is this. So I found out why, because doctors here in this new state have asked me, like, why is your mom on a blood thinner? I'm like, I don't even know. Doctors in hospitals, when my mom's fighting for her life, and they do stuff even though I'm invoked healthcare proxy, and they don't communicate with me, they don't tell me. But she was put on ALICIA for atrial fibrillation, which means her heart quivers. I knew that Jardiance, she doesn't have diabetes, I found out about the Jardiance. The Jardiance is, as I suspected, doing my own research online, off-label, and it was for congestive heart failure. And she also has cardiomyopathy. So to sum it up, a lot of things wrong with her heart. Here's my epiphany. Learning all of this, at least now I know, because they had to take her because of the brain bleed from her head injury 7 weeks ago, give or take. It happened July 4th weekend, so you do. They took her off of the ALICIA and off the baby aspirin, they're both blood thinners. And they do that for precautionary reasons, it's protocol. But she'd been off it now for all these weeks, like almost 2 months. So the doctor who took her off of it, we had that phone appointment with him, and he basically passed it on to have her primary care physician decide. Yeah, but she's the one who originally asked me, her office, like, why is she on it in the first place? So they have to determine whether women should be back on it, but my guess is she should. And then they were saying, well, the doctor wasn't around, holiday weekend, that she might want my mom to get blood work done to see how my mom's blood is and whether or not she should go back on recite. Whatever they decide, she hasn't been on it. She wasn't on it the entire time in the nursing facility. But I still have it from before. I have a lot of it because I had just filled her meds. Before. All that happened. Now my foot's hurting me and I don't know why. The other video was rubbing here because that was hurting me. It's like this whole leg is hurting me. There could be something awful going on with me. Who knows? I was afraid I was going to have to call 911 on myself. And now we'll circle back to that, okay? I ended up taking a long shower because if I had to go to the hospital, whatever, I at least wanted to be clean, and I haven't taken a shower in a week. So I did the whole hair wash, even used conditioner. For the past few weeks, like the couple weeks, I don't know, when is the last time I used conditioner? Sometimes when I'm rushed, I know I'm not going to dry my hair anyway, so I don't even bother using conditioner. You know, if I was going to visit my mom and all that. But I did the whole kit and caboodle. I had my mom doing her pictures or her coloring or doing whatever at the table. Begged her, please don't do anything. Please just stay here safe, Mom. I really have to take a shower. I don't feel well. And I had tea and, I just didn't feel well. Mom, please, I just need to take a shower. What I'm not telling her is I feel like I might have to go to the hospital, and then what happens to you? We'll circle back to that. Because within this reality, my reality in this life right now, that is my biggest fear. And even though it's late and my mom's gonna call me, I was watching The Voice, they're in the battles now, and it's like really exciting. But my mom's gonna call me in a minute to take her to the bathroom. And she might even pull her shit when she doesn't go back to bed. And I risked it. Big question is, I'm getting older and older. How long will I be able to sustain this type of situation without something bad happening to me? But I did take a long shower, washed my hair, and told my mom was okay. It started hurting me, I don't know why. So I didn't do anything to it. Why is she yelling to know the time instead of saying pee-pee?